Hello, my name is Dr. Milas, and I am your urinologist today. I am a physician who specializes in diseases of the urinary tract and the male reproductive system. As a urinologist, I diagnose, treat, and monitor disorders of the urinary tract and the external genital organs, which can include the kidneys, the ureters, the urethra, the bladder, and the prostate. I have opened up a private practice here in Denton where I have seen a majority of my referred patients from Texas Women's University and the University of North Texas. Due to how common urinary tract infections are, I see patients with UTIs daily. A UTI occurs when bacteria gets into your urine and travels up to your bladder. A majority of my patients come in with pain or burning when they urinate, which is often the first sign of a UTI or bacteria in the urethra or bladder. According to the Urology Care Foundation, UTIs cause more than 8.1 million visits to the healthcare providers each year. About 10 in 25 women and in 3 in 25 men will have symptoms of at least one UTI during their lifetime. The treatment that I recommend to my patients, depending on the severity of their UTI, is often a short course of antibiotics, more so a 3 or 5-day course to get better. If the UTI is complicated, which is an extended UTI where you're having chronic UTIs, then a longer course of antibiotic is given and is often started in a hospital through the IV. A short period of IV antibiotics are given, followed by a course of antibiotics given by mouth after being released home. Certain lifestyle changes and hygiene help reduce the risk of bladder infection, such as wiping from front to back after urination or a bowel movement, and gently washing the skin around the vagina and the anus daily using mild soap and plenty of water. Also, another key thing to prevent UTIs is to urinate immediately after sex. I cannot stress how important that is. So, in my case study, I have a girl by the name of Ashley White, who is a middle class 21-year-old Caucasian student who has been having chronic UTIs for the last 6 months. After mentioning she has a new partner in her life, I administered a visual exam of the bladder and urethra with a lighted scope cystoscopy, as well as obtaining a urine culture test to check for bacteria. As a urinologist, I prescribe her a intermediate or self-diagnosed antibiotic therapy. For instance, taking an antibiotic after intercourse or starting a course of antibiotics supplied in advance by yourself. When Ashley starts feeling her symptoms, she can immediately start taking her medication to prevent that UTI from spreading or becoming an infection. So, for a health educational strategy, I would recommend including educating the public about urinating after intercourse. I cannot stress that enough, you guys. A lot of people are growing up now and they do not know that they have to urinate after having sex. That's a key thing to do. We should have a public service announcement about that so people can know. Also, to incorporate proper hygiene on a daily basis. Hygiene is so important to prevent UTIs. I recommend doing research on different types of fabrics that you also wear as undergarments because different undergarments suit different bodies, which are going to help you identify which panties give you a UTI and which panties don't, and which ones are better for you in the long run. Also, to do research on different deodorant sprays or scented feminine products and their effects on UTIs. A lot of people aren't aware that a lot of feminine products they use have a lot of chemicals in them, which may increase the chances of you catching a UTI because of wearing that. The one thing I would want everyone to take serious is a UTI. If you see your patient with a chronic UTI, make sure you work on that as soon as possible, because a UTI can become a serious infection which can be life-threatening if affected through the kidneys. Thank you so much for watching. Please let me know if you have any comments, questions, or concerns, and have a blessed day. This is Roshni Amidas, and I